The court has ordered essential workers back to their posts. It follows days of protest in this public sector strike. The health minister saying it has led to the deaths of patients. Well, what's happening down in KZN and more specifically Durban? Nqobile Madlala on the ground for us. And let's go down there and find out what it's looking like this morning as well. Not sure if it's peaceful or if we are expecting the Nahawu members. Nqobile, so give us a sense of what it's looking like where you are.
Well, very different, I can tell you now, Gareth. I'm just going to show you what's happening today. We can see the security guards have already started working. We've seen the gate opening here in KwaMashu Community Healthcare Center. You'll remember that yesterday there were so many members that were protesting or rather striking here yesterday with a lot of nurses outside, healthcare officials outside. But today we're seeing a different picture. Security guards are working. They've opened that gate quite a number of times. We've seen patients going in. We've seen some of the nurses also even attending to people from the gate. Yesterday we saw a woman that needed assistance in that gate whilst she's waiting for one. Today we're seeing a different picture with people being attended to on time, and they are going back. You will remember, Gareth, that there was a major question around who is going to be essential, who is essential worker and what that means. And there were questions around whether there will be a continuation of that strike by Nahawu. But we do understand that under COVID, people who were healthcare workers, they were all declared as essential workers. So everybody is basically back to work in the healthcare sector. KwaMashu was also one of the areas that were affected. A lot of issues like antenatal wards were one of the areas that were affected. Today we're seeing mothers going in with their children, and you can see that there's a different take in terms of starting work again. So we are going, of course, to monitor what will be happening throughout the day, because these were not the areas that were only affected. We remember that courts was also affected. We remember that Home Affairs was also affected. We remember that driving license areas were also affected because of this protest action that was dubbed public. You see, public workers were protesting. So we're seeing a different picture in the healthcare sector, but in terms of the other areas, we will monitor them to check if there will be a change in terms of that. But for now, everybody back to work. As you can see, mothers going in now to get that assistance that they've been waiting for in KwaMashu Community Healthcare Center.
And obviously you've been covering this for the past few days. You're at a community centre now, but are you hearing anything in Nqobile at some of the bigger hospitals where we'd even seen the SAPS, Metro, and in some cases even the Army having to come out to assist? I know that's a small clinic where you are now, but I'm sure you're keeping an ear to the ground for the other big areas as well.
Yes, of course, Gareth, we have to check. You'll remember that some of the areas that were also affected were in Pietermaritzburg. Grey's Hospital being a tertiary hospital that was greatly affected. We saw on the first few days it was completely shut. At some point we even had the CEO coming out to speak to the workers to really just beg some of them to get that skeleton staff in so that there could be some assistance for people that were there. So areas like that have been greatly affected. Northdale is one of the hospitals also in Pietermaritzburg that were greatly affected, with a lot of people blocking their area. And we also started to hear things like from PSA that there was intimidation for the workers that wanted to continue working. In areas like KwaDabega, in areas like Port Shepstone in the South Coast, there were people that had to go to work not wearing the work clothes because they were so scared that they will be victimized. But we do know from PSA, having spoken to them in the morning, that most of their staff is also back at work. Most of the Nahawu staff is back at work. We heard from the minister saying that if people are not back at work, there will be no work, no pay. So you will understand that after 7 days of not having any money coming in, most of these healthcare workers would also want to think about what will happen at the end of the month. But we did hear from Nahawu as well that there were going to be continued meetings between them to sort of find out out what will be the way forward, because it's not just the health sector that was going to be affected because of the strike. But yes, we are keeping our ear on the ground. We are checking what is happening. So far, it seems most of these healthcare centres are currently working. We are going to keep checking to see if there's anyone that is not at work. So far, everyone is back at work.
Oh, it's good news as far as patients and patient care is concerned. It's been a very messy week last week. Nqobile, thank you very much indeed. Down for us in KZN, down for us in Durban. As she said, she'll check in with the bigger hospitals a little bit later, but it's wonderful to see from a healthcare perspective, seeing moms with their little ones being able to walk into a clinic and get whatever help it is that they need this morning.